There are 3.1 million registered nurses in the US, as compared to 660,000 doctors. There are 5 times as many nurses as there are doctors, and nurses have become the primary caregivers in the healthcare system. In order to provide the best possible patient care, nurses must be motivated. Hello, I'm Steven Saranowski, and I'm going to be doing an analysis of the bedside nurse. Here's a quick overview. Like I said before, I'm going to analyze the bedside nursing position at your hospital, specifically in the geriatric unit. The job task for a bedside nurse includes communicating with doctors, providing direct patient care, such as feeding, clothing, and bathing. And then they must schedule medication usage for patients. And lastly, they must transfer patients from unit to unit. And here's a quick preview of what I'm going to talk about today. We're going to talk about the goals and performance expectations for a bedside nurse, as well as the nurse's ability to perform, reinforcement, salience, equity, timeliness, and lastly, I'm going to provide some recommendations. As far as bedside nursing qualities, nurses must be organized, they must be dependable, and they must have excellent communication skills. They're the foundation for the geriatric unit. They're the primary caregivers, and they're the direct line of communication for the doctors, nursing managers, and the families. As far as performance expectations, bedside nurses are expected to communicate and coordinate with doctors. That includes what medications they should take, what tests they have to have done, and whether or not they need to be transferred to a different unit. And next, they must schedule the patient's day. They must schedule when the patient's supposed to eat, bathe, and when they should take their medications. And lastly, they must catalog the patient's progress. And basically that means that they're going to provide feedback to the patient's family. As far as their ability to perform, bedside nurses typically have an associate's or a bachelor's degree, and they have to have a minimum of 1,800 to 2,000 clinical hours. As far as the resources, patient laundry is cleaned weekly, and medical supplies are replenished daily. Reinforcement, good performance is rewarded with a 5% annual pay raise, and bad performance receives the standard 3% annual pay raise. Pay raises are based on quarterly performance reviews, and there are 3 performance reviews, and that equals a 5% pay raise if they're all positive. As far as salience, rewards include the possibility for further education, consideration for a managerial position, and lastly, a pay raise. Feedback from the nurses really enjoy the rewards, and they think that they are adequately compensated for their work. As far as equity, the employees believe the reward system is fair. The rewards are distributed equitably, and they like that the rewards are based on behaviors. It takes into account what one does, it's not based on personal traits, and it eliminates bias. As far as timeliness, feedback is provided quarterly. There are annual pay raises. There's consideration for managerial positions if the person has been in the unit for 2+ years, and there's consideration for further education if the person has been in the unit for 2+ years as well. A few recommendations I would have include putting more nurses in the day and night shift. The next one is to provide more timely performance reviews, and then to provide more immediate rewards for nurses. Now I'm going to talk a little bit about each of these. As far as recommendations for allocating more nurses to the day and night shifts, the geriatric unit has 100 patients and pretty much at max capacity at all times. There are 8 nurses in a shift, and that means there's a 13-to-1 patient to nurse ratio. If there were 10 nurses in a shift, it reduces the ratio to 10-to-1, and basically this puts less pressure and less stress on the nurse, and it allows them to provide better patient care. And the next recommendation I have is to provide more timely performance reviews. Basically, I would suggest having more informal performance reviews, and I would do that monthly. The reason I would do that is because it lets nurses know where they stand, and then basically it can correct poor performance if the nurse is getting off track and having a poor performance at the workplace. And next, I would keep the formal performance reviews because I feel like that's adequate performance tracker as far as every 4 months letting them know how they're doing. but also providing that monthly aspect to it, so it really, reinforces good behavior. And it really lets the nurse know where they stand and whether or not they're on pace for rewards. The next recommendation I would have is to have more immediate rewards. The current reward system, rewards take at least a year to attain, and nurses could become discouraged during that time. I would provide simple rewards for good performance during the quarterly performance reviews. Something I would suggest is maybe a new set of scrubs, because most nurses pay for their own uniform, and this would give them a good variability in their workplace wardrobe. And the next one I would say would be an additional vacation day for a superior performance during 1 year. I would also limit this to 1 per year. And then lastly, something simple such as maybe a free lunch in the cafeteria. So it really lets the nurses know that they feel appreciated. In conclusion, today we analyzed the strengths and weaknesses within the unit. I provided some recommendations, and just to reiterate what they are, those were allocating more nurses to the day and night shifts, providing more timely performance reviews, and then lastly, to provide more immediate rewards. And basically, the last step is to implement these changes. It will lead to better employee satisfaction and better patient care. Thank you for your time.